Hi everyone, it's Dr. Charles here at Active Life Chiropractic in Rapid City. We have Dr. Michaela here, and we're kind of going to go through a breakdown of the pattern of squatting. So this is a movement that we're going to use daily, whether you're sitting down on the toilet, getting up from the chair. It's ingrained in our movement pattern, but oftentimes when you're in pain or you have an injury, this movement pattern gets broken down and may become dysfunctional. So today we're going to be having Michaela do a few squats for us, and we're going to just point some things out to look for in the treatment room, as well as when you're doing activities you love to do. So to start off with, we're going to have Michaela face this way. So what I like to tell my patients is just do a squat. So we don't need to coach them like, do this with your knees, do this with your ankles. Just see what their movement pattern is. I'm happy to do a few more, Michaela. And back. Good. So as you can see from the side angle, what I'm looking for here specifically with my patients is what their low back is doing as they get to the bottom of the squat. If there's an increased amount of flexion, that's something that I just take note of. Not inherently bad, but it's just something to pay attention to. As well as ankle mobility. So I'll have Michaela squat again and kind of pause at the bottom here. So at the bottom, her spine is nice and straight here. There's a little bit of that flexion of the low back, but this minimal amount, if it's not causing her pain, is okay. I'm looking at the feet to see if the knees are going over the toes, which they are. And then I'll have you face the camera. Have you do a few more squats here, Michaela. And from here, you may stand behind the patient looking at what their feet are doing. See if there's any pronation or the arches of their feet are collapsing. Oftentimes that's normal as long as they're able to use their foot functionally. And also in the back, I'm seeing if there's any lateral shifting or things like that. So the big takeaway here is everyone squats differently. There's not one perfect squat for every person. Whether you like to go wide, toes out, feet parallel, whatever you like to do is best as long as you're able to perform it correctly to you and not have pain and dysfunction. So if you're looking for more assessments with how you like to move in and out of the gym, feel free to contact activelifesd.com, book an appointment today, and make sure you subscribe to our YouTube channel.